Under eye bags are red in color, plus dark circles. Is there a solution other than surgery? I have under eye bags red in color, plus dark circles. I tried many natural remedies proposed on the internet, but no improvement. I checked with a doctor, and he told me that there is no solution other than removing the fat under my eyes. He said this is purely a hereditary issue, but I don't see this problem on any of my immediate families. I stare most of the time on PC and don't sleep 8 hours. Is there any solution other than surgery?
Thank you for your question. You submitted your question with some photos, and you are describing in the details of your question that you are dealing with these under eye puffy areas and reddish in color and dark circles, and that you have tried some remedies that were recommended on the internet, and you met with a doctor who said that the only solution is surgery and this is a hereditary problem. And further, you're questioning why you don't see anybody in your immediate family with these problems, and can you find a solution without surgery? Well, I can certainly help you with this question as I discuss this issue with my patients every day in my practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people with these under-eye bags and discolorations, both surgically and non-surgically, has been the core of my practice for several decades now. So I can certainly help you understand a little bit about the question of genetics and heredity. We always assume that we are products of just two parents, but reality is that genes get passed on through generations, and sometimes one particular gene or set of genes is responsible for essentially what this condition is. And what is this condition? This condition is first something called lower eyelid fat prolapse. Lower eyelid fat prolapse means that the fat that's normally around the eyes pushes forward and creates a hernia, and that's why it's referred to as herniated fat. The reason why these remedies did not work is that this fat has a lot of volume. And you're in good company. A lot of my patients come in with having gone to every department store and retailer and bought all kinds of creams, and ultimately found these not to be effective. Further, I would say that at this point there are options in approaching patients who have a little bit of lower eyelid fat prolapse. And the absence of a physical exam or a little on other angles of your appearance of your eyes, I can basically break it down to you in two approaches that we apply for this particular problem. The first approach, which is often what people want, is something that's minimally invasive, because everyone's afraid of the word surgery. And so when someone has a mild amount of fat prolapse, it's not a solution, but rather a camouflage approach. And what we do is we use an under-eye filler, a filler such as a Restylane or something in the hyaluronic acid family, or Juvederm, and placing it at the level of an area called the tear trough. What that does is it blends the area of the prolapse with the area of the bone structure. The limitation of this is the relative projection or prolapse of the fat. So if somebody has such prominent under-eye bags, and I suspect looking at your photos that you may fall into this category, then surgery is a treatment of choice. In my practice, I routinely perform this procedure through an approach called a transconjunctival blepharoplasty. What this means is that these fat pockets are approached from the inside of the eyelid, and they are reduced and repositioned as is appropriate, and it is a highly effective procedure. Now, for patients who, like yourself, who want to avoid surgery, What we do in our practice is we perform these procedures in our own facility within our practice. And these facilities are essentially equivalent to doing it in a hospital or surgery center, as we are certified by the Joint Commission. And this is very important for a lot of patients, of course, because they want to maximize the safety. And further, the technique and approach is so minimal in a way that essentially going into my office and either getting an injectable filler or going in and having a surgery, the only difference is you're in the operating room and you do get a little sedation. But the procedure is as minimally invasive as one can get and still actually address the problem definitively. It's done from the inside of the eyelid. There's no external scars, and the anatomy of the eyelid is maintained. Now, to respond to the question about the redness and the dark circles, for your skin type, we have had a lot of success in using something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it is something we do routinely in combination with the surgery. What we're basically doing is taking the wound healing and growth factors from your blood and separating them and injecting them under the skin as well as in the space where the surgery is done. We have found this to be a very useful thing to help our patients with these dark circle issues. And further, beyond the surgery, it's something that a lot of patients choose to do as a maintenance thing to optimize the appearance of their skin. It's a choice you make depending on how things look and how important it is to you to manage the dark circles. So one approach is to deal with the fat pockets, the other is to deal with the skin. And of course, there's always different lasers and other things that are continuously available and evolving to help us further improve the outcomes for our patients. And combining procedures is often a great strategy to get the best aesthetic result. So meet with qualified, experienced cosmetic surgeons who do a lot of eyelid surgery. Learn about your options, learn about platelet-rich plasma or PRP, and I think it is in your best interest to choose the procedure that'll give you the more definitive outcome in a way that you're comfortable, rather than continuously chasing approaches that like the home remedies or other remedies that haven't been so effective. I hope that was helpful. I wish you the best of luck. Thank you for your question.